The information you will listen to in this video has been prepared by making use of the package insert of the drug. If the video is useful for you, don't forget to like the video and subscribe to the channel. The active ingredient of EFEXOR capsule, which is in the group of antidepressant drugs, is venlafaxine. Venlafaxine is known as a serotonin norepinephrine reuptake inhibitor. What is EFEXOR and what is it used for? EFEXOR, it works by helping to restore the balance of certain natural substances in the brain. Venlafaxine is used to treat depression, anxiety, panic attacks, and social anxiety disorder. It may improve your mood and energy level and may help restore your interest in daily living. It may also decrease fear, anxiety, unwanted thoughts, and the number of panic attacks. How to use EFEXOR XR? Take this medication by mouth as directed by your doctor, usually once daily with food, either in the morning or evening. Do not crush, chew, or dissolve this medication. Doing so can release all of the drug at once, increasing the risk of side effects. Swallow whole without crushing or chewing. If you are taking the capsules, swallow them whole. If you have trouble swallowing the capsules whole, you may open the capsule and sprinkle the contents onto a spoonful of applesauce. Swallow all of the mixture right away without chewing. Drink a glass of water after each dose. The dosage is based on your medical condition and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Take the missed dose as soon as you remember it. However, if it is almost time for your next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. If you are taking the extended release capsules, do not take more than one dose per day. Here are some things to know before using EFEXOR. Do not use EFEXOR if you are allergic to any ingredient in EFEXOR. You are taking or have taken a monoaminoxidase inhibitor within the last 14 days. You are taking linezolid or medicines for weight loss. Contact your doctor or healthcare provider right away if any of these apply to you. Before using this medication, tell your doctor or pharmacist your medical history, especially of bleeding problems, personal or family history of glaucoma, high blood pressure, heart problems, high cholesterol, kidney disease, liver disease, seizure disorder, thyroid disease. This drug may make you dizzy or drowsy or blur your vision. Alcohol or marijuana can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness or clear vision until you can do it safely. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana. During pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. This drug passes into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. Side effects of EFEXOR include nausea, drowsiness, dizziness, dry mouth, constipation, loss of appetite, blurred vision, nervousness, trouble sleeping, unusual sweating, or yawning may occur. If any of these effects last or get worse, tell your doctor promptly. This medication may raise your blood pressure. Check your blood pressure regularly and tell your doctor if the results are high. If this video was useful for you, for support, like the video and subscribe to the channel. Share your views and experiences in the comments section. I wish you healthy days.